Now, remember I said never lose an A, and I mean don't lose them because you didn't market, you didn't build relationships, you didn't stay in touch, or you didn't handle a problem well. But we are noticing a lot of new surgeon clients saying, well, I lost an A or two. They retired, they sold, they brought in a young associate who thinks they can do all the implants, or we have DSOs competing with us nearby. And I got a lot from that DSO until they brought in their own surgeon. That's a realistic syndrome. And my point is you've got to be replenishing your A's. And the data would indicate it can take 2 to 5 years to bring a new A on board. So if you wait until you wake up one day and your A retired or got sick, you don't just go get another one overnight. Either way, acknowledge that you are going to need new A's because A's are valuable. One of the good and bad syndromes we see is we'll get a new client and 23% of his or her revenue is coming from one office. And that's great, but it's also dangerous because if you lose that office, in fact, it wasn't surgical, but we had an orthodontist that just called us. He's down 59% in referrals overnight because 59% of his referrals came from a pediatric dental practice, 5 pediatric dentists, and they just brought in their own orthodontist. And essentially, this is an almost impossible turnaround given that the orthodontist is 55 years of age. Very, very difficult situation. A's are great. A's will make you find a way to be in front of your A's on a regular basis because they're just so powerful as part of the process.